Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the US and around the world and give you expert insights on infectious diseases and public health. And I'm happy to have today Dr. Jon Epstein, a friend and colleague of mine who's a veterinarian, a virologist, a disease ecologist who's worked on infectious diseases around the world. And on today's episode, we're going to do a rundown of some outbreaks that are occurring around the world that are relevant to all of us, particularly if you're here in the United States. And we're going to cover two important outbreaks that you may have heard a little bit about in the news, but there's some timeliness about these that's worth bringing everybody up to speed about them. Thank you, Jon, for joining me today.
Yeah, thanks, Jay. It's great to be here.
Okay, so the first disease that we're going to talk about is an Ebola virus outbreak that's been going on in Uganda. And one of the reasons you may have heard about this isn't maybe so much about the cases that are occurring in Uganda, but it's obviously about all of the dismantling, essentially, of the public health infrastructure here in the United States and around the world by the current administration. One of the talking points that came out during one of the press conferences fairly recently was about how President Trump's Department of Government Efficiency with Elon Musk had been canceling all of the U.S. government foreign assistance. And there was a statement made by Elon Musk saying, well, we accidentally canceled Ebola prevention, and then we realized we made a mistake, and then we turned it back on. Those of us in public health, especially those of us who have worked extensively overseas, know, first of all, this isn't how it works. You can't cancel prevention and then turn it back on. And unfortunately, from everybody I know who is currently working overseas and has worked overseas, unfortunately, U.S. government's assistance in this area has now gone away. The U.S. really is not an important player right now with these ongoing outbreaks. So with that kind of long lead in, that's kind of what I think is really kind of one of the timeliness hooks here, is that it is obviously of relevance to people living in Uganda and nearby countries, but it's also relevant to the United States because the role we play in this and how we help control it is also how we keep ourselves safe. And the most recent news about this outbreak, outside of the preamble that I just gave you about the politics here in the U.S., is that there was a unfortunate death a few weeks ago of a 5-year-old in Uganda of this disease. And there have now been 2 additional cases linked to this 5-year-old. So, Jon, before we get into the kind of details about these cases and how the outbreak evolved, can you tell us a little bit about this specific outbreak? One of the things that may confuse the attentive reader is that if you look at the World Health Organization documents about this, it actually refers this as Sudan virus disease. So I'm curious if you can explain to the viewers, first of all, what is Ebola virus and what is Sudan virus and what's going on right now in Uganda with this?
Yeah, thanks, Jay. I think the world, if it didn't already know about Ebola, was introduced to it back in 2014, 2015, when we had the West Africa Ebola Zaire outbreak, which was the largest Ebola outbreak ever recorded, more than 22,000 cases, half of whom died. And this was of interest because not only did it spread rapidly among 3 West African countries, but travelers brought Ebola virus to Europe and to the United States. So it really did become a global epidemic. And in this case, we have a different type of Ebola virus. Ebola viruses are a group of viruses, a group of related viruses that all cause similar types of disease. Zaire Ebola virus is one type of Ebola virus, and Sudan Ebola virus, which was originally discovered in Sudan, is a different species or type of Ebola virus, but related and causes similar disease. All of these Ebola viruses have the potential to cause high degrees of fatality when they get into people. And of course, they're infectious, so they spread from person to person.
How do people originally get infected with these Ebola viruses?
It's been one of the questions that I think has been plaguing public health officials for the 50 or more years we've known about Ebola viruses. It's been an elusive mystery, but we know a lot more now than we used to. And where the majority of scientific data points to is that Ebola viruses in general, and also other related viruses in a broader category called filoviruses, which includes Marburg. I'll get to that in a second, Marburg virus disease. These viruses tend to be carried by bats. And we didn't originally know that because people, starting from the 70s, when we first were aware of Ebola virus, people would get infected and spread it to other people. And there's very little understanding of where the first case or how the first case got infected. But particularly over the last 20, 30 years, there have been extensive studies looking at potential wildlife reservoirs. We know, for example, in the mid 2000s, there was a big Ebola outbreak in the Congo in Central Africa. And not only did it infect and kill a lot of people, but great apes were being infected as well, gorillas and chimpanzees. We know that some of the human cases were started when hunters went into the forest and harvested infected animals, particularly some antelope, chimpanzees, and gorillas, and they became infected that way by consuming the carcasses of infected animals. So that was one key to how people might be getting infected. We've gone on to ask the question, well, how did gorillas and chimpanzees get infected? They also were vulnerable to this disease. They died from it. They probably weren't the original source. And there have been a multitude of studies, some that I've been involved in, some that other scientists have been involved in, looking at bats as potential reservoirs. And it turns out that different types of bats, living depending on which geography you're talking about, tend to carry viruses like Ebola and related viruses. And the type of bat it is depends on the geography, but that is our best understanding right now of where these viruses tend to come from, is that bats are a natural reservoir, and exactly how it gets from bats into people also varies depending on the virus and the context. And I'll give you an example, and this is probably relevant to Sudan virus. Marburg, which is a related type of virus that causes a fatal infection in people, causes a fever, sometimes rashes and hemorrhaging. Marburg virus is carried by a particular type of bat that lives in caves and mines. And we know that many of the cases of Marburg virus have been miners who have been working in caves where these bats live. And they've gotten exposed through probably inhalation of droplets of excreta, urine or feces from these bats. These are viruses that don't make bats sick per se, but when they get into people, they cause really bad disease. So we know in the context of Marburg virus that there's that kind of transmission, aerosolized or droplet transmission to people. And then from there, people can spread it to other people. We don't know that as well for Ebola virus, or in this case, Sudan virus, but we're operating under the assumption that Sudan virus also comes from a type of bat.
Yeah, and I think this is, for a lot of viewers, especially here in the United States, this is always this challenge. They're like, well, how do bats make humans sick? Well, as Jon, as you can go into, and I don't think we'll cover it a lot in this episode, but maybe in a future one, humans end up interacting with bats in all sorts of ways, particularly if you live in less urban areas. And then once that happens, of course, once you get that spillover, you eventually get to disease in humans, which I want to touch on in a moment. So I'm going to talk about, we talked just for a moment about how humans get infected by animals, primarily by bats. We don't know exactly how it happens. But before we get into how then the outbreak grows, tell us a little bit about why it's called Sudan virus and not just called Ebola virus.
Yeah. Well, viruses, often are named for the place they're first discovered. So this virus first caused an outbreak in people in Sudan. And so far, there have been about 8 different outbreaks of Sudan virus in Sudan and some in Uganda, including the most current one in Uganda.
Yeah, and so the thing about this outbreak, and the where I come in here as the the human health more human health focused person, is that what ends up happening inevitably with these spillovers is they tend to occur in areas in which more rural areas where people are interacting with animals and wildlife, including bats, in lots of different ways.
Right.
But then eventually somebody gets sick and they go to a healthcare facility, they go to a hospital. Often these are facilities that don't have a lot of resources, particularly don't have a lot of, personal protective equipment. And, somebody comes in with a fever and gets sick. There may be lots of people in the same room, family members, other patients, and then eventually it spreads. And what we know about this outbreak that started back in January is that the first case notably was a nurse. And I don't know the personal details on this, and I'm sure they're known to the public health investigators, but I would probably suspect that the nurse was not the one that came into contact with bats in the wild. That almost certainly that first nurse, particularly because they were in Kampala, which is the capital of Uganda, and anybody who's been there, like Jon and I have, knows, it's a very busy, crowded urban area. That nurse who got sick almost certainly got infected by a patient who we just don't know where that came from. And this is unfortunately how these Ebola outbreaks then tend to amplify, right? So there's a spillover event. A person then seeks care in a healthcare facility. That person infects other patients, workers, maybe family members that are visiting in the hospital, and then it spreads out to the rest of the communities. And so that's one of the reasons why these outbreaks can be so challenging to stop.
Yeah, and a particular feature of Ebola and related viruses, which we really learned during that West Africa outbreak in 2014, is that after a person dies, they can still remain infectious for a period of days. And so anyone having contact with a person who's died from Ebola, and presumably that's also true from Sudan virus, is also has the potential to get infected. And so funerals and funeral practices became a major spreader outside of healthcare facilities, but families that would traditionally have contact with a dead body during ritual funeral practices were getting infected by Ebola virus. And so that might also be, interfamily spread, or contact with someone who's died from Sudan virus may also be a risk factor for spreading this virus.
Yeah, so I spent 2 months in West Africa during the large outbreak from 2014 to 2016 in West Africa, and I was based in Sierra Leone. And it was very obvious to me, as somebody who that was the first Ebola outbreak I had sort of managed, was there are really basically three major places in which these outbreaks amplify, or you get these super spreading events. There are certainly opportunities where a random person could get infected by physical contact, and we've pretty much touched on two of those, and I'll talk about the third in a moment. The first is in these healthcare facilities, right? People who are sick go to the healthcare facility. There isn't early recognition they have Ebola. There isn't a special isolation room to stick them in where they can be, kept far away from other people. So the outbreak spreads so infections spread in the hospital. The second, as Jon has mentioned, is funerals, because what is unique, as Jon pointed out about this, is that people are at their peak level of infectiousness the moment that they die. And so anybody who's in contact with it, so it's hospitals, it's funeral services where bathing the body, particularly in Islamic cultures, is considered absolutely critical to the sort of spiritual life of that person and their family members. So you're talking about hospitals, talking about funerals. And then the third is deliveries of babies in the home. A lot of births are done in the home. And then if a mother has Ebola virus, not only do they spread it to the newborn baby, but the birth process often involves, it's generally done by women with their other female family members or female members of the community. And of course, these births have a lot of blood, right? There's blood everywhere in any birth, regardless of how healthy the mother is. And they can be amplifying events. And now when we get back to why we're talking about this today, this most recent severe illness and death was in a 5-year-old. And it does appear that this child is associated with additional cases and almost certainly got infected in the home during a delivery. And so really, to stop outbreaks in the African continent, you need to really address the hospital safety, you need to address the funeral safety, and then you need to address these deliveries and to make sure they're done as safely as possible.
Yeah, and it's amazing, and you know this from being there. The family unit and the village unit are so tight socially, whether it's somebody who's sick and people rallying around to help take care of them, or as you say, these birthing events or funerals, it all involves really close, kind of intimate and personal contact among family members and close relatives, right?
Yeah, absolutely. And it's a wonderful thing about many of these cultures, right? That people do really band together as communities to keep each other healthy. But of course, in the process of bringing together people to be healthy, there's also the paradox, right? That if somebody is sick, that's also an opportunity to make other people sick at the same time.
Yeah.
And so, should Americans be worried about this outbreak right now? What should they be worried about, Jon?
No, I don't think they should. I mean, we saw Ebola in the West Africa outbreak travel. We saw people with Ebola travel and come to the United States. But even then, the risk of spread was quite low. Here in the United States, we have good public health infrastructure, surveillance that would hopefully identify cases and isolate them before they could, potentially infect others. So as of now, this is an outbreak to pay attention to. And as you mentioned at the start of the show, U.S. involvement in outbreak response globally and assistance with countries to help them contain outbreaks has been vital over the past few decades. And suddenly that's a little bit in question. And so we should also pay attention to outbreaks internationally just to see. And it isn't that governments don't have the capacity to control and contain these, but it is harder for them now. There's more of a challenge for them without international assistance. And so we need to pay attention to these things.
Yeah, and I'll also just flag, I'm really worried about the ability to detect and respond early here in the United States. As we dismantle, we fire all these workers from CDC, we cut off funding that goes to state and local health departments. I know when I was in New York City, we relied on a huge amount of funding from CDC, from the federal government, to launch our Ebola response where we had one confirmed case. We had somewhere between 150 to 200 suspected cases over a 2-year period. And we could not have launched that in New York City, even though we were one of the most well-funded, if not the most well-funded health department in the country. So I'm going to keep my fingers crossed and hope that we still have people screening people at the airports who are coming in from these countries, that we still have the infrastructure in our hospitals. But there is a real worry that I have there too. And so let's switch gears a little bit. There was one other outbreak we wanted to talk about today. This is from a virus that many of you I will bet that most of you haven't heard of. And the reason I can make that bet is I didn't know about this virus until maybe about 6 months ago, when I first started reading about the origin of outbreaks. And this virus is called Oropouche. And I'll briefly explain why we're even talking about it today. Basically, there has been a wide and expanding outbreak of this virus not in the United States, but mostly in South America and Central America, and now spreading to the Caribbean. But that doesn't mean it won't reach here. And we know that because on March 14th, the Wisconsin Department of Health reported a case of Oropouche virus causing meningitis in somebody who is a Wisconsin resident who had traveled to Panama. We don't have any more details about that visit. Presumably they were there on vacation. But, even though this disease is not spreading here in the United States, it is spreading in parts of the world where we travel often. And so, John, tell us a little bit about Oropouche. What is Oropouche virus?
Yeah.
How do we know about it in the past, and what do we know about it right now?
It's amazing to be talking about this at all right now, but you're absolutely right. It's something to pay attention to, primarily because it's a virus and unrelated to Ebola or influenza or other viruses we've talked about so far. But Oropouche virus is a virus that is carried by animals, particularly wildlife, in the Amazon basin. And why we're talking about this is because it has expanded its range to infect humans outside of just Amazonia and into the Caribbean. And so we see it expanding its geography. It's a virus that, interestingly, is carried by sloths. That's one of the natural reservoirs, as well as potentially some wild birds and some non-human primates. And it gets from these animals into people through biting flies and mosquitoes, little midges that you might not even be aware of or notice. You might not feel them even bite you, but they are the vector or the insect that transmits the virus from the wildlife that they may bite to people, and certain mosquito species as well. And when it gets into people, it can cause fairly mild symptoms, right, Jay? Fever, kind of malaise, lethargy that most people will get through with supportive care, maybe treat the symptoms. It's not that often fatal, although you mentioned in some cases it can be. But it is of concern because it is spreading in geography, and something we would expect, with changing climate and with all the travel we do, to be present possibly even in the southern United States at some point.
Yeah, and I think the interesting thing about this is you talk about how it's a disease that is normally found as the natural reservoir of sloths.
Yeah.
And one would hope that this is a slow-moving animal that lives somewhere, out in the jungles. And so, how am I going to come into contact with a sloth? And it turns out, again, for people out there to understand, this is why our health of humans is so connected to everything else. It doesn't matter if the sloth doesn't move and just hangs out in a jungle in a tree. Other things that can fly can come into contact with that sloth and then eventually bring it to us.
Yeah, and it isn't as though the sloth itself is a risk. I mean, I love going to see wildlife in its natural habitat, and some of my best memories are going to Costa Rica, where I watch sloths in the wild. It's a real thrill. But as soon as we put ourselves into the same environment as wildlife, there is the potential for that kind of disease transmission, particularly when it's vector-borne. So this isn't about someone touching a sloth or coming too close to it. This is about being in the same environment where those biting flies occur, and likely will have bitten sloths and monkeys and other non-human primates, and then have the opportunity to bite people. And you might not even know you're infected until you come back home after your vacation. And that's how these viruses move from one part of the world to another.
Exactly. So flying, right? So you've got mosquitoes, midges that fly. They come into contact with a sloth. They bite a human. A human then flies on an airplane back to the United States, and then it comes here. And then, so just for people to understand a little bit about this disease, it kind of presents the same way you might expect any type of flu-like illness, right? You get bitten, and then somewhere between a few days to 10 days later, you'll start off getting a fever, a headache, you'll feel achy, your joints will ache, and then it'll last for, 5 to 7 days. And most people just get better, and they think, hey, I just had the flu. Who knows what happened? But there's a couple of reasons to be concerned. One is that, like a lot of other diseases that we know about, this can actually infect your brain system, like infect your what you call meningitis. So the fluid that basically circles your spinal cord in your brain, and that can cause much more severe symptoms. We know people can get all of the complications that you can get from any type of viral illness, a disease called Guillain-Barré syndrome, which is where you get paralysis because probably from a hyperactive immune system. And we also know, just like any type of viral illness like this, you can be laid out for a lot longer than that period of fever. People get weakness and malaise that can go on for a month or more. So yes, it's very unlikely that this disease will kill you, but it can certainly make you feel kind of crappy for a while.
And Jay, what about pregnant women? Are they particularly at risk for Oropouche?
Yeah, so I think one of the other things that we have learned now about viruses, and Jon, of course, is the one that's been looking to find all these and where they are in the world, and learning all these surprises about how they spill over and how they evolve. And one of the things from the human health side, people like me have been discovering, is that these illnesses do not just stay from mosquito or midge biting human. So if you're a pregnant woman, you can unfortunately infect your baby. And there has been a report that came out last year from the World Health Organization for the Americas, what's called PAHO, documenting that unfortunately this virus, if you are a pregnant woman and you get infected with this virus, your baby could be born with abnormalities, a small head, other type of abnormalities, and may even die while still in the womb. Okay. And so this is very reminiscent of the outbreak we had, that was caused a lot of widespread concern, that I led the outbreak response for New York City, of Zika virus, right? About 9 years ago, where again, we had a virus that you could get from the bite of a mosquito or some other flying insect that could then spread and infect your baby. And then the second piece about this is, it's not just a risk if you are a pregnant woman to get bitten. We also now know that this virus can also be found in the semen of men. So if you are a man who gets bitten and gets this disease, you could pass it on to your female partner. And if they then get pregnant, or they are pregnant at that time, it may make them sick. So this is very reminiscent of what happened during Zika, where we're now discovering a number of viruses. And this actually extends to Ebola, it extends to monkeypox. Viruses are surprising us in ways that we hadn't thought of before, of spreading through the sexual route.
And that makes it particularly difficult to monitor these viruses, because you may have someone who gets infected that way, has no travel history. So a clinician might not even think to ask if they've been to a place where these viruses are known to occur, and suddenly they're infected with it. So it's all the more reason to be aware of them, to understand the clinical presentation and talk to your doctor about it. And it makes me think about really the importance of, whenever you travel, particularly the tropics, insect prevention, making sure you're wearing long sleeve clothing, you're using repellent to avoid getting bitten by mosquitoes, and in this case, biting flies, because there's just so many things that we do know about, and even more we don't know about, that you'll be protected from if you prevent yourself from getting bitten.
Yeah. So Jon, I think that's a great way for us to close up here. Advice for everybody who's out there, who's interested in this topic. One of the most important things is, if you are traveling through Central America or the Caribbean, which a lot of people are probably going to be doing with upcoming spring break season and the Easter holidays and the Jewish holidays, you got to be careful. Okay. It means make sure that these are great places to vacation and to see amazing things, whether it's beaches, mountains, jungle, fun city
wildlife.
But you know what? Stay away as much as you can from insects and bugs, or keep them away from you. As Jon mentioned, long sleeve coats, repellents. And if you get sick with an illness that lays you out in a way you hadn't realized, make sure you see a healthcare provider and make sure you mention to them your travel history. One of the mistakes a lot of clinical people make is they don't ask, where have you been lately? So make sure you let them know. And then the last point I'll make about that is, use extra precautions. If you're a man who has a female partner that you're trying to get pregnant or might get pregnant, pay particularly close attention to your health and your safety about these bugs. And if you are a pregnant woman traveling to these areas, make sure you be really careful about staying away from insects as much as possible, using repellents, mosquito nets, etc. Great, Jon. Anything else you wanted to add?
No, I think we covered a lot of ground today, but it's always interesting to pay attention to what's happening around the world.
Great. Well, thank you very much for watching. And we're going to keep covering issues about outbreaks that are occurring both here in the United States and around the world, and giving you information that you can use, whether you're in clinical practice or whether you're traveling overseas, or you're just interested in what Jon and I certainly believe in, which is that the health of all of us is interconnected, and it's interconnected to humans around the world. It's connected to animals around the world, even if you're a sloth living in the Costa Rican jungle somewhere. Great. Thank you all very much, and we'll see you in the next video.
Bye-bye.